So the GLOW study is a study where Venetoclax and Ibrutinib were combined, so that is different than the antibody. It's a completely oral regimen of fixed duration, again 1 year of treatment with Venetoclax and Ibrutinib. I presented the primary analysis at EHA a few months ago, and what we focus on in this ASH is MRD levels. And what we actually see is indeed that there are more patients getting to an undetectable MRD state, but we also see, and maybe that's even more relevant, is that with this combination we get patients in deeper responses also if you look to the other compartments, not only blood and marrow but also of lymph nodes. And what we have seen, we have data on after treatment plus 3 months and after treatment plus 12 months. And what you see is that patient with undetectable MRD remained extremely stable, but also patient with a positive MRD. And that's maybe a bit different than Venetoclax and an antibody, because there you see that most patients with a MRD positive disease or maybe borderline, they rapidly increase their cell numbers again and disease re-emerges. And it seems very early that with Venetoclax Ibrutinib, although you might have MRD positive disease after treatment, it seems to be much better sustained than with the other regimens. Of course, we didn't make that comparison. That is an ongoing CLL17 study from the German group, also an intergroup study. But what we actually think we see indeed is that the VI regimen gives very good clearance of all 3 compartments. And if I make then a small loop to another trial that we did, this is the HOVON-141, which is also discussed tomorrow morning by Karsten Niemann, the first author. That is a HOVON trial that we get together with the Nordic group. And there we actually took the next step, and that's not only giving fixed duration, but actually can you completely stop treatment when you are MRD negative, and can you restart treatment when patients become MRD positive. And the reason we did this is if you look to a disease like CML, that's actually what we do in that disease. In that disease you treat until MRD negativity, and at that point you stop, and some patients will never need retreatment, some patients will, and most of those patients, virtually 100%, will again respond to the same treatment that have given before. And what we show in this trial with more than 200 patients, that indeed patients that we had 3 cohorts. So we first gave a 15 cycle of Venetoclax and Ibrutinib treatment. Patients that had a MRD negative result at cycle 12 and cycle 15, they were randomized to either continue Ibrutinib or to stop in a 1:2 ratio. A patient that stopped, a good portion of them could remain without therapy for the follow-up months, but some patients also did had MRD positive disease. We retreated those patients with the same regimen, Ibrutinib and Venetoclax, and virtually all patients again responded. So that's maybe the next step from a fixed duration treatment to MRD guided treatment, which I think is the next step in personalized medicine, what we should aim for.